When a therapist is asked how many sessions a week they can do before burning out, you'll find a variety of answers. Many people will say around 20. This is very interesting to me. And I'm curious, why? Why is it that therapists can only see about 20 patients a week before burning out? Is there research behind this? Well, not specifically with therapists, but if we look over at medical residents, patient outcomes, maybe over 80 hours a week, start to dwindle. So that's quite a bit different than 20. If we look at something high risk like surgery, okay, a surgeon may have a 30-hour shift. 30-hour shift? That's one shift. It seems like talking about feelings wouldn't be as dangerous, but there's this idea that it is, or that therapists will burn out. Some potential factors. Therapists do not like, generally speaking, this isn't for everyone, but generally speaking, therapists don't like to do their notes in session. So what this means is they'll see patients through the day, then they have extra work at the end of the day. Also, many therapists don't like to eat in session, so they may go a few hours without eating. That can absolutely physically make it difficult. Also, therapists, many that are in private practice, do their own billing. So, you see patients for 5 hours, for example, then you have notes, and then maybe on the weekend you have billing. This starts to add up so that the amount of hours worked is comparable to a 40-hour job. Also, many therapists, in private practice, they like to answer their own phone. So if you're scheduling everyone over the phone, answering new people, getting back to people, all of that on top of therapy, yeah, that's a lot of hats that will take up some time. This is just the logistics, but now let's talk about the emotional aspect. With some things like emotionally focused therapy, a therapist has to manage two people's emotions, be hyper empathetic and aware of everything that's happening in the room right then and there. So they're feeling everything. They are feeling what's going on. That takes an emotional toll. Now, I, as a therapist, I could not do 8 hours of emotionally focused therapy. That would be a little much. So then, why is it that some therapists, like myself, can work 30 hours a week or more, see 30 patients or more, and not burn out? Well, let's go over what we just talked about. There is this emotional toll. Well, if those sessions, if they're back to back, it's going to suck. However, if a therapist is trained in multiple modalities, they can be emotionally focused one session. Another session, it might still be trauma work. It might be something like EMDR, but the therapist has this specific protocol that they are doing. It might make it easier in that session, or next session, maybe it's cognitive behavioral therapy. And you're talking about learning new skills. That makes it so it's emotionally not the same every single session. So multiple modalities emotionally can decrease the emotional toll. Also, things that I talked about earlier, one of the reasons I'm able to do it is because I eat, I drink water, I have a biller, not saying that other therapists don't eat, but just generally in session, I don't think most do. I'll snack. Now it's like something intense, no, but I do. I take notes in session. I have an answering service. So all those extra hours that I normally would have to do, I now don't. And I get to focus on doing what I love, and I get to diversify how I'm doing it. I can have one session be one modality, another session be another modality, and it doesn't become overwhelming. So it is possible for a therapist to see 40 patients a week and not feel overwhelmed and not burn out. But for the reasons I gave earlier, this is why many therapists choose to have a lighter load and see 20 patients a week. Thank you for your time.